As the number of new daily cases continues to rise in South Africa, 2,563 infections were recorded yesterday. The total number of cases recorded since the start of the pandemic is 787,702. So the health department says 38 more people have died from COVID-19 related illnesses, putting the number of fatalities at 21,477. So the health minister also told the SABC earlier today that containment measures will be needed to avoid a second wave of infections amid the festive season. Let's speak more about this now. Professor Bulie Magula, who is the head of Department of Internal Medicine at the University of KwaZulu-Natal, joins me now. Prof, a very good evening to you. Thanks indeed for your time. So how much of a concern is the increase of COVID-19 infections in some parts of the country, especially now that we enter the festive season?
Good evening, Prisalda, and good evening to the viewers. And thank you for having time to have this conversation. It is a serious concern that we are seeing numbers increase, particularly at this time when people normally would be moving from places of work where they have been to their homes, in different parts of the provinces. And as we enter a time that as a country we know as a festive time to be celebrating the year. So it is a serious concern.
Prof, I'll come back to that and, the interprovincial travel that we'll see quite a lot in the coming weeks. But could what we're seeing now mean the introduction of perhaps localized restrictions or tighter restrictions? We're hearing now from the health minister that there's a possibility that government, is looking at tighter measures in certain parts due to what we're seeing.
It's difficult to say what restrictions government will impose, but one could say, just from looking at what is unfolding, that the numbers would actually dictate very stringent measures to be taken to cap the spread, especially in those localized areas, because if a drastic action is not taken, then the chances of the infection spreading to other parts where we are not seeing as many numbers, it actually becomes quite high.
Yeah. Prof, how would you manage something like that? Tomorrow is the 1st of December. We're going to see in the coming weeks increased interprovincial travel. The concern is that, when everyone returns to their respective places of work in January, South Africa does not want to sit with the risk of a second wave in the beginning of a new year, given that you're going to have a lot of people traveling towards their families, their homes, to holiday destinations, because obviously many would not want to travel internationally at this point. So whether you're going to see family, whether you're going on holiday, you're going to see a lot of interprovincial travel. How do you deal with something like that, where it's going to be very difficult to manage people moving around in the next coming weeks?
I think first and foremost, we need to go back to the education that we get everyone to be aware and remind everybody about the seriousness of this infection and the fact that a lot of people have died. People know that. So if we are all reminded by it and are also reminded by the fact that it is a preventable infection and anyone that is dying from it is dying from a disease that is essentially preventable. So we go back to the basics that we have been talking about, the fact that we have to make sure that we're wearing masks, and we must understand why we're wearing masks. We wear masks because we could be infected and we don't know that we're infected. And when we talk or we cough, we could spread the infection. And so it's important that at all times we wear masks and we don't share these masks. We wash our hands with soap and water for a good at least 20 minutes or use hand sanitizer if we can't do that. That we keep our distances. And as people travel, we are actually aware that we should be, as individuals, as members of society, that we all take personal responsibility on this. And when we do feel any symptoms, whether it's sore throat, tiredness, coughing, that we report our symptoms and we get tested. And when we do get tested, doctors should know, anybody that's doing a test, that it's important that we put under quarantine, or request people to get under quarantine. Facilities are available in government facilities where people who are suspects or who have been tested because they are suspects, they can get placed under quarantine while they wait for their results. That we don't go into taxis when we could be infected and we don't even know that we're infected. So that once we're under quarantine, when the result comes back and it's positive, we can then be put under isolation safely in facilities.
But I guess, Prof, what more can be done? The messaging has been there. I think everybody understands now what these non-pharmaceutical methods are of wearing masks and sanitizing. But the truth of the matter is, in the coming weeks, you're going to have thousands of people moving in between different provinces. You've also got, I guess, lockdown fatigue that also plays a role, where people have to balance between that and getting to their destination. So what in addition does government need to do? I think everyone is aware of the non-pharmaceutical methods that you just spoke of, of wearing masks, of sanitizing, keeping that social distance.
So every single person has a responsibility to do that. And if we can't do that, then government has to take those decisions, because we can't do our part, which is then to restrict our movement. And so that is what government would then have to consider. If we can't do the simple things, and where we actually need assistance because we can't social distance and our circumstances do not give us an opportunity to be able to social distance, this is where government should then be intervening to say, how do we then assist those people who, no matter how much they know, they're not able to social distance because of their living conditions and so on. But by and large, lockdowns are not sustainable. We have seen what impact it has had on our economy. But I still believe that lives actually come first. And if the economy has to suffer to save us, which will still be unfortunate because we are failing to do what we as citizens of this country are supposed to do.
Prof, I'm afraid that's where we're going to have to leave it. Thank you very much indeed for your time this evening. Professor Bulie Magula, who is the head of Department of Internal Medicine at the University of KwaZulu-Natal. Thanks indeed for your time this evening. So at about, when we come back from the break, we'll cross live to the Tambo Foundation, where Dr. John Kani will be delivering the 7th annual Oliver Tambo Memorial Lecture. The theme of this lecture this year is Arts and Culture as a Mechanism for Liberation. Stay with us. We'll see you after the break.